Hello, this is Gretchen O'Connor. I'm a physical therapist here at Grace Lake Rehab. This is a recording of a workshop I previously presented entitled How to Regain Core Strength After Baby. So I'm going to share the screen with the PowerPoint that goes along with this talk. And there we go. Okay, there we go. Move me up a little bit. And again, my name's Gretchen O'Connor, and this is how do I regain core strength after baby. Like I said, I'm a physical therapist here at Grace Lake Rehab, and I customize programs for women to help them move easy through life. What makes my programs unique is my experience as a mom and a physical therapist, combined with my training in prenatal and postpartum exercise, as well as functional movement rehabilitation. I've been a physical therapist for 33 years. I took a long time off after kid number 3 and kid number 4. I returned about 4 years ago. When we ran the numbers and started looking at college tuitions, it was time for me to get back to work. One of the things that was really interesting that was after the time that I had off and the continuing education I had done, and as I came back to work, what I found was that my interest and my experience combined with the profession as a whole had really kind of changed direction. When I worked previously, it was a lot of you have a knee problem, you fix the knee problem. You have a shoulder, you address the shoulder. And how things are right now and how my thinking has changed is you are rehabbing the entire person, and the body is a system. And you need to look at how things are moving and how interconnected and how related everything is. Because if you don't address the whole system and you only address that one part, the body's not going to function the way it's supposed to. The other piece of that puzzle, which I came to understand and realize the importance of, is that breathing and core control are the foundation for all of our movements and all of our work as we go through life and how we use our bodies. And unless you dial that in, things are never going to work in your body the way that they should. That also led me down the path to do a lot more research and do a lot more learning and work specifically with prenatal and postpartum patients. So one of the things that happened as I was home with my kids, and as anybody who has kids knows, 1 feels like 1, 2 feels like 20. As number 2 came along, one of the things that I tried to do was to get us out of the house every day and keep everybody occupied and tire everyone out so that we all had good naps together, was pack a little picnic lunch, go to the playground around the corner. When number 2 kid came along, number 1 was about 2.5 years old, and we would pack up and get ready to go. But at 2.5 years old, she was potty training. So I had to time things just right. What I found was she couldn't hold her bladder very long, and nor could she be away from the house for too long. So I had to time it just so. And what I found was that it wasn't just her, it was me. I was having a hard time holding my urine for too long. And I felt like I just couldn't hold much at all. I would sneeze or cough or laugh and feel like I was going to lose a little bit of control, or sometimes did. Playing with her on the playground, I would go to catch her as she jumped off something and could feel that like loss of control again, lifting the baby out of the car seat. And then when I tried to run, it definitely felt like I just did not have the control that I should. So what are we supposed to do about that? And is it normal? It absolutely is not normal. Physicians will tell you, and sometimes other moms will start talking and you'll say, oh, everybody's got the same issue. It's expected after you deliver. It's not necessarily expected. And just like every other muscle in your body, the muscles that control your bladder can also be strengthened and help to prevent some of that and reverse a lot of that. If you were to start a strength program, and if you ever have before, if you're trying to squat or deadlift, you don't start with 200 or 300 pounds. You start just with the movement itself and get the muscles working and see how your body responds. And then you progress it safely in a very controlled manner so that you don't injure yourself. One of the other challenges we face when we go to the doctor and the OB postpartum at our 6-week visit, you ask what your restrictions are, what can you do, what can you not do? Oh, you're good. You can do whatever you want. You're free to do whatever exercise you want now. You say, well, you know what, I'm noticing my bladder just doesn't have the same control. I feel a little bit of leaking, and oh, yeah, just do some Kegels. Yeah, that's all you really need. Is it? And will that help? Is that the answer for everybody? Sometimes. So I'm going to say maybe, but there's a lot more to it than that. Just like any other exercise, it's not just the quantity or what you're doing, but more so how you're doing it. And if you're not activating the muscles that are supposed to be doing the work to control that movement or control that bladder, things won't improve, and things could actually get worse if you're not doing it right. So I want to dive into a little bit of anatomy here, and I'll keep it pretty broad and general. So here, first, the skeletal system, and you think of the skeleton as the framework around which the rest of our body is formed and built. And again, the bones just go end to end and form joints. And then if we keep going and overlay the muscles on top of that, I'm not expecting you to remember all the details, but if you look at, hold on, sorry. There we go. If you look at the system in general, what I do want you to get an appreciation for is that there's a lot of layers and a lot of overlapping and a lot of interconnectedness among all those muscles. When we talk about the abdominal muscles, what a lot of us think about is a six-pack in the middle here. That's just one of your abdominal muscles. There's a whole lot of layers that go not just on the front, but along the sides and around to the back of your belly. Now, if you were to take your belly or take your body, slice it in half like so, you're going to see the inside of the pelvic floor, and then at the bottom of the rib cage is your diaphragm. I'm going to pause here for just a second. Okay, so if here is my rib cage, and you can look from the side as well. What I want you to think about when I talk about your diaphragm in a moment or two, your diaphragm is a giant muscle that helps you breathe. And as you inhale, that diaphragm will press down. As you exhale, that diaphragm will relax and come back up again. Well, it's a three-dimensional muscle. Think of it like an umbrella sitting underneath your rib cage, that as I breathe down, that diaphragm comes down. All the contents of your belly need to go somewhere. And as you exhale and that diaphragm comes back up again, everything will come back in. That'll become important in a moment when I go through some of the breathing. Let me come back to the PowerPoint. Okay, there we go. Wrong way, sorry, there we go. So we think of the core as a canister, and the top of that canister is a diaphragm that I just talked about. The middle is the abdominal muscles that run all the way around your body, front, sides, and back. The bottom of that canister is the pelvic floor, which I'll show a picture of in just a minute. If you look at the size here, your diaphragm really is about the top 25%, your abdominals the middle 50%, and the pelvic floor the bottom 25%. If you're not getting a good deep breath where that diaphragm is activating and then the pelvic floor also activating with that breathing, you're missing up to 50% of how those core muscles can work or should work. You're only working those abdominal muscles, you're missing up to 50% of how things should be going. There we go. All right, so if we peel away your abdominal muscles and take out the insides of your belly, you look at just underneath the rib cage right through here, this is your diaphragm muscle. And again, there's a giant kind of lopsided umbrella. What I also want you to get an appreciation for, some of the portion of that diaphragm muscle comes down and attaches to your spine. These are your vertebrae along the back of your belly. If this muscle is not activated and strong, part of it acts as a stabilizer to your spine. And if that's not active and strong, that's not able to stabilize the way that it should. Now, if you were to slice your belly in half this way and look down into the pelvic floor, what you'd see, here's your belly over on this side, your back over, your bottom over in this direction. What you would see, again, are a whole lot of muscles that line the pelvic floor. And those muscles, again, I want you to get an appreciation for how things overlap, as well as the different directions that they all go in. So how do you get your core to work? Let me go through a little bit of demonstration, and you can try this. And if I don't give you enough time or feel like you need a little more, just pause the video and try again. Okay. So as I'm sitting here, right, let me go from the side. If you were to think of your pelvis as a bowl, and that bowl is even right in the middle when you're on your sits bones, but you can also tip that bowl forward so that if the bowl was full of water, you can spill water out the front. You can also tip that bowl backwards so water spills out the backside. So just kind of go back and forth. So you're tipping the bowl forward, tipping the bowl backwards. Okay, just, you don't want to force it through comfort and into pain, but just nice and gentle. Get an appreciation for the motion that you have going backwards and going forwards. I'm going to have you tip it backwards so you feel like the water spilling out the back of that bowl. And if you were to try and stop gas, go ahead and do that. And now relax and let the gas go. And go ahead and try and stop that gas again. And relax and let the gas go. I'm going to have you go the other direction. Tip forward. And now I want you to try and stop P. And then relax and let it go. And then try and stop the P again. And relax and let it go. Okay? If you come to the middle, so you're on your sits bones and that pelvic bowl is even, the water's not spilling forward or back, it's just balanced right in the middle there. Now I want you to try and stop both the gas and the P, and then relax and let it go. And try and stop them both again, and relax and let it go. So a couple things to note. Some people will notice they have a hard time stopping the gas. Other people have a hard time stopping the P. Some people have trouble relaxing one or both areas of that those pelvic floor muscles. Other people, so a lot of times you'll notice when you really work hard to stop the gas and stop the P, you'll start to feel your abdominals, your glutes, sometimes even your legs or your neck or your shoulders kicking in to help out. If you get to the point where you're kicking in a whole lot of extra muscles, those probably need a little bit more strengthening because they should be able to be controlled by themselves, not have your whole body work. If you're putting a lot of effort into it, yes, you'll have some extra help. You shouldn't feel too much. So I'm going to go a little bit further here. So we have you rest your hands on your belly. Some of you, everybody has probably tried to do some diaphragmatic breathing, where your belly breathing, we talk about it. Or if you're in yoga, they'll talk about breathing here and staying not a lot of movement here. So from the side, switch hands here. So you'd be going. So not a lot of motion here, but a lot of motion down at the belly. So if you think back to what I talked about, the diaphragm and being an umbrella, it's not just the front that as that diaphragm sinks down will expand out. All the way around your belly should expand out. So let's have you rest your hands on the sides of your belly. I like your fingertips on the lower rib cage, your index finger, your other fingers around your belly here, and thumbs around the backside. So that as you breathe in, go, and then exhale back out again. And as I'm inhaling, what I'm feeling is my belly expanding into my hands. And exhale back out. So it's not just my fingers on the front, or my palms on the side, or my thumbs in the back, but all the way around as I inhale. And then exhale. Things expand all the way around here and then contract back down again. So how do we connect that to the pelvic floor now that we got that diaphragm moving and expanding all the way around here? What I want you to think about is as you inhale, everything's going to relax. So not just expanding here, but also you can think about breathing into that pelvic floor. So as you inhale and then exhale, okay, inhale, breathe down into the pelvic floor. Again, that diaphragm is dropping down. Things don't just have to expand around the middle, they can expand and put a little pressure down onto the pelvic floor. What I think it feels like is that you put a little pressure on the bladder, like you might almost have to pee a little bit, but then as you exhale, the pressure comes off and things feel normal again. You may also feel the backside as you put the pressure down. Feels like you might have to pass gas a little bit, and then as you exhale, things come off. Okay? The pressure comes off and it feels normal again. So let's go through that breath in again, and then exhale. Okay? Let's connect the pelvic floor contractions we did before to the breathing we're doing now. So as you inhale, I want you to think about relaxing that pelvic floor. So as you breathe down into that pelvic floor, that pelvic bowl, you'll feel like you have more pressure and the gas in the pee. You're just going to relax and let it go. And then as you exhale, contract and let that pelvic floor pull back up again. Okay, so go ahead, inhale, relax the pelvic floor, feel the pressure on the bladder and the bowel, and then as you exhale, stop the gas in the pee so you feel like things are holding in again. Then inhale, expand and relax, and then exhale, contract the pelvic floor. So we'll go through a couple more. Inhale again, relax everything, and then exhale, contract. So you should be able to do that in any position, whether you're sitting, laying down on your side, your back, your stomach, or standing up. As you'll also be able to control some of that. So So practice that in different positions. See how that feels. Start to make that connection. Oftentimes those pelvic floor muscles just have not been used as much as they should have. So once you start using them, things start to activate and you don't even need to think about how they're actually going to work. They should just start kicking back in and doing what they're supposed to. I'm going to come back to the PowerPoint here. Okay. All right, so we talked about the pelvic floor activation. We talked about that 360-degree down into the pelvic bowl, diaphragmatic breathing that expands all the way out as well as down, and then connecting those two together. So that connection breath, as you inhale, the pelvic floor relaxes, and then as you exhale, the pelvic floor contracts. And again, oftentimes it's a very conscious thing right now, but once those muscles start to wake up and do what they're supposed to, oftentimes it just falls into place and you don't have to think about it as much anymore. And that is something you should be able to do in any position. That's the start of getting the core to work. Okay. I'm going to pop back here just one more. Let me stop here for a sec. All right, let's go through one more layer of muscle activation here. All right, so I still want you to do that same inhale, where that diaphragm drops down, pelvic floor relaxes, and on the exhale, I really want you to force all the air back out again as the pelvic floor contracts. So go ahead, inhale, fill that belly all the way around, relax the pelvic floor, and then exhale. Keep exhaling, keep exhaling, keep exhaling. And now relax and inhale. As you exhale, try and exhale all the way down to you feel like you might cough. Okay. And inhale, relax that pelvic floor again. And then exhale, forceful all the way out, contract that pelvic floor. Right. So what you should start to notice is that as you exhale forcefully, you'll start to get a little bit of an isometric contraction, and the harder you exhale, that isometric around your abdominals will feel even firmer, and you can start to get those muscles activated there. That isometric contraction and that connection between the diaphragm, the pelvic floor, and the abdominals in the middle is a first step to getting that core activated and resuming some of that strength and gaining some of that control back after you've delivered. All right, so let me come back here. All right. All right. So again, oftentimes what will happen when that core is not working, when the abdominal muscles are not kicking in, the pelvic floor is not kicking in, that diaphragm isn't working the way it should, our body was very good at compensating and substituting. Some muscles will overwork, other muscles will underwork. Once we get things balanced again and everybody's contributing their fair share, things start to feel better. Muscles will start to activate, their body will start to work the way it's supposed to. You think about balance in life and balance around home. There's those days where mom is doing everything. You're doing the groceries, you're doing the cooking, you're doing the laundry, you're doing the cleaning, you're doing everything everywhere. Then there's those other days where you're like, okay, hit the pause button. Somebody help with sorting the laundry. Somebody help bring in the groceries. You help me get this part of the dinner prepared. And life seems to settle down a little bit. There's a little more balance in the house. Same thing happens in your body when things are not balanced. Some overwork, other muscles underwork. So like I mentioned running earlier, and I love to run. I'm very slow and I'm not good at it, but I have done a couple marathons. When I had my kids, after kid number one, I tried running again a couple months later and just kind of felt like I was plodding along, but just kind of pushed through it and did a little bit. After kid number two and kid number three, I did a lot more walking and chasing than anything. After kid number four, though, I decided I really wanted to get back into running. But at 36, I didn't need or want an injury at this point. So I was really careful about what I did and how I did it. Started with some core exercise, started with some hip strengthening, really watched my movement patterns and how I was doing things hour to hour and day to day around the house, and very gradually got back to starting running again. So fast forward 13 years, and my youngest is now 13 after my last delivery, and decided I wanted to run a marathon after I turned 50 and see how I could do again. Trained really carefully, progressed really slowly, watched and listened to my body, really worked on the breathing and the core strength along with the running and the progressive distance training on my long runs, and ended up hitting my goal of breaking the 5-hour mark for a marathon. I told you I wasn't very quick, and I definitely am not. But what I found was that when I finished that marathon, yes, I was sore from running the 26.2 miles, but my body felt okay. It didn't feel like I had another injury here or another injury there. And what I also noticed was that I could move easy through the rest of my life again. Day-to-day stuff just didn't hurt the way it did before. And that was the best part of all that training. So where do you go from here? Well, the connection breath that I started and getting that core activated and getting things working the way that they should on a very basic level is the first step. Oftentimes you can just carry that over into the exercises and the activities and the movements that you're trying to do through your day. When you can't is when you might need a little bit more help. And I would be happy to walk you through that and train you through that here at Grace Lake Rehab. And I will be it would be my pleasure to help you travel the shortest distance between injury and recovery. Here is my email address and phone number here at the office. Please feel free to reach out if you have any questions or if you feel like you need a little bit more information. We can chat, and if you need an appointment, we can set you up with that. Thank you very much for listening and watching. And I am Gretchen O'Connor, and I'm here for you at Grace Lake Rehab when you need help traveling the shortest distance from injury to recovery.